Hey, Alpha Nurses, I'm Licensure from alphanursguy.com. These are NCLEX practice questions. Without the way, let's get started.
Which assessment findings should lead the nurse to suspect that a toddler is experiencing respiratory distress? Select all that apply. 1. Coughing. 2. Respiratory rate of 35 breaths per minute. 3. Heart rate of 95 beats per minute. 4. Restlessness. 5. Malaise. 6. Diaphoresis. The correct answers are 1, 2, 4, 6. Coughing, especially at night and in the absence of an infection, is a common symptom of asthma. Early signs of respiratory distress include restlessness, tachypnea, tachycardia, and diaphoresis. Other signs also include hypertension, nasal flaring, grunting, wheezing, and intercostal retractions. A heart rate of 95 beats per minute is normal for a toddler. Malaise typically does not indicate respiratory distress. A nurse administers cefazolin instead of ceftriaxone to an 8-year-old with pneumonia. The client has suffered no adverse effects. The nurse tells the charge nurse of the incident, but fears disciplinary action from reporting the error. The charge nurse should tell the nurse, 1. If you do not report the error, I will have to. 2. Reporting the error helps to identify system problems to improve client safety. 3. Notify the client's primary care provider to see if she wants this reported. 4. This is not a serious mistake, so reporting it will not affect your position. The correct answer is 2. Client safety is enhanced when the emphasis on medication errors is to determine the root cause. All errors should be reported so systems can identify patterns that contribute to errors. Here, the similar names probably contributed to the error. The nurse who commits the error knows all the relevant information and is in the best position to report it. While the primary care provider should be notified, it is a nursing responsibility to report errors, not a primary care provider choice. Relating mistakes to a nurse's position focuses on personal blame. A 10-year-old child who is 5'4" tall with a history of asthma uses an inhaled bronchodilator only when needed. She takes no other medications routinely. Her best peak expiratory flow rate is 270 liters per minute. The child's current peak flow reading is 180 liters per minute. The nurse interprets this reading as indicating which of the following? 1. The child's asthma is under good control, so the routine treatment plan should continue. 2. The child needs to use her short-acting inhaled beta-2 agonist medication. 3. This is a medical emergency, requiring a trip to the emergency department for treatment. 4. The child needs to use her inhaled cromolyn sodium. The correct answer is 2. The peak flow of 180 liters per minute is in the yellow zone, or 50% to 80% of the child's personal best. This means that the child's asthma is not well controlled, thereby necessitating the use of a short-acting beta-2 agonist medication to relieve the bronchospasm. A peak flow reading greater than 80% of the child's personal best would indicate that the child's asthma is in the green zone or under good control. A peak flow reading in the red zone, or less than 50% of the child's personal best, would require notification of the healthcare provider or a trip to the emergency department. Cromolyn sodium is not used for short-term treatment of acute bronchospasm. It is used as part of a long-term therapy regimen to help desensitize mast cells and thereby help to prevent symptoms. The nurse is preparing to administer the last dose of ceftriaxone before discharge to a 1-year-old, but finds the IV has occluded. The nurse should 1. Restart the IV. 2. Administer the medication intramuscularly. 3. Arrange for early discharge. 4. Contact the prescriber to request a prescription change. The correct answer is 4. Restarting an IV for 1 dose of a medication may not be in the infant's best interest when the medication can be given in an alternate form. The prescriber should be contacted to determine IM or PO options. Rocephin may be given IM, but changing the route of medication administration requires a prescription. Failing to complete an entire course of antibiotics contributes to the emergence of antibiotic resistance and would rarely be the best option. An adolescent with chest pain goes to the school nurse. The nurse determines that the teenager has a history of asthma, but has had no problem for years. Which of the following should the nurse do next? 1. Call the adolescent's parent. 2. Have the adolescent lie down for 30 minutes. 3. Obtain a peak flow reading. 4. Give 2 puffs of a short-acting bronchodilator. The correct answer is 3. Problems of chest pain in children and adolescents are rarely cardiac. With a history of asthma, the most likely cause of the chest pain is related to the asthma. Therefore, the nurse should check the adolescent's peak flow reading to evaluate the status of the airflow. Calling the adolescent's parent would be appropriate. But this will be done after the nurse obtains a peak flow reading and additional assessment data. Having the adolescent lie down may be an option, but more data need to be collected to help establish a possible cause. Because the adolescent has not experienced any asthma problems for a long time, it would be inappropriate for the nurse to administer a short-acting bronchodilator at this time. A charge nurse is making assignments for a group of children on a pediatric unit. The nurse should most avoid assigning the same nurse to care for a 2-year-old with respiratory syncytial virus and 1. An 18-month-old with RSV. 2. A 9-year-old 8 hours post-appendectomy. 3. A 1-year-old with a heart defect. 4. A 6-year-old with sickle cell crisis. The correct answer is 3. RSV may be spread through both direct and indirect contact. While contact and standard precautions should be employed, a measure to further decrease the risk of nosocomial infections is to avoid assigning the same nurse caring for an RSV client to a client at risk for infection. A private room is preferred, but if this is not an option, the nurse should understand that children 2 years of age and younger are most at risk for RSV, especially if they have other chronic problems, such as a heart defect. From an infection control perspective, pairing 2 clients with RSV is ideal. RSV infections are less likely to pose a serious problem in older children. A 7-year-old child with a history of asthma control without medications is referred to the school nurse by the teacher because of persistent coughing. Which of the following should the nurse do first? 1. Obtain the child's heart rate. 2. Give the child a nebulizer treatment. 3. Call a parent to obtain more information. 4. Have a parent come and pick up the child. The correct answer is 3. Because persistent coughing may indicate an asthma attack, and a 7-year-old child would be able to provide only minimal history information, it would be important to obtain information from the parent. Although determining the child's heart rate is an important part of the assessment, it would be done after the history is obtained. More information needs to be obtained before giving the child a nebulizer treatment. Although it may be necessary for the parent to come and pick up the child, a thorough assessment, including history information, should be obtained first. A teaching care plan to prevent the transmission of respiratory syncytial virus should include which of the following? Select all that apply. 1. The virus can be spread by direct contact. 2. The virus can be spread by indirect contact. 3. Palivizumab is recommended to prevent RSV for all toddlers in daycare. 4. The virus is typically contagious for 3 weeks. 5. Older children seldom spread RSV. 6. Frequent hand washing helps reduce the spread of RSV. The correct answers are 1, 2, and 6. RSV can be spread through direct contact, such as kissing the face of an infected person, and it can be spread through indirect contact by touching surfaces covered with infected secretions. Hand washing is one of the best ways to reduce the risk of disease transmission. Palivizumab can prevent severe RSV infections, but is only recommended for the most at-risk infants and children. RSV is typically contagious for 3 to 8 days. RSV frequently manifests in older children as cold-like symptoms. Infected school-age children frequently spread the virus to other family members. When developing a teaching plan for the mother of an asthmatic child concerning measures to reduce allergic triggers, which of the following suggestions should the nurse include? 1. Keep the humidity in the home between 50% and 60%. 2. Have the child sleep in the bottom bunk bed. 3. Use a scented room deodorizer to keep the room fresh. 4. Vacuum the carpet once or twice a week. The correct answer is 1. To help reduce allergic triggers in the home, the nurse should recommend that the humidity level be kept between 50% and 60%. Doing so keeps the air moist and comfortable for breathing. When air is dry, the risk for respiratory infections increases. Too high a level of humidity increases the risk for mold growth. Typically, the child with asthma should sleep in the top bunk bed to minimize the risk of exposure to dust mites. The risk of exposure to dust mites increases when the child sleeps in the bottom bunk bed because dust mites fall from the top bed, settling in the bottom bed. Scented sprays should be avoided because they may trigger an asthmatic episode. Ideally, carpeting should be avoided in the home if the child has asthma. However, if it is present, carpeting in the child's room should be vacuumed often, possibly daily, to remove dust mites and dust particles. The nurse observes an 18-month-old who has been admitted with a respiratory tract infection. See the figure below. The nurse should first: 1. Position the child supine. 2. Call the rapid response team. 3. Offer the child a carbonated drink. 4. Place the child in a croup tent. The correct answer is 4. The child is in respiratory distress and is sitting in a position to relieve the airway obstruction. The nurse should provide a humidified environment with a croup tent with cool mist to facilitate breathing and liquefy secretions. The child should remain sitting to facilitate breathing. The nurse should allow the child to determine the most comfortable position. After the child is breathing normally, the nurse can offer fluids. The primary care provider also may prescribe intravenous fluids. The nurse can call the rapid response team if the respiratory distress is not relieved by using a croup tent or changes in other vital signs indicate further distress. After discussing asthma as a chronic condition, which of the following statements by the father of a child with asthma best reflects the family's positive adjustment to this aspect of the child's disease? 1. We try to keep him happy at all costs. Otherwise, he has an asthma attack. 2. We keep our child away from other children to help cut down on infections. 3. Although our child's disease is serious, we try not to let it be the focus of our family. 4. I'm afraid that when my child gets older, he won't be able to care for himself like I do. The correct answer is 3. Positive adjustment to a chronic condition requires placing the child's illness in its proper perspective. Children with asthma need to be treated as normally as possible within the scope of the limitations imposed by the illness. They also need to learn how to manage exacerbations and then resume as normal a life as possible. Trying to keep the child happy at all costs is inappropriate and can lead to the child's never learning how to accept responsibility for behavior and get along with others. Although minimizing the child's risk for exposure to infections is important, the child needs to be with his or her peers to ensure appropriate growth and development. Children with a chronic illness need to be involved in their care so that they can learn to manage it. Some parents tend to overprotect their child with a chronic illness. This overprotectiveness may cause a child to have an exaggerated feeling of importance or later, as an adolescent, to rebel against the overprotectiveness and the parents. In preparation for discharge, the nurse teaches a mother of an infant diagnosed with bronchiolitis about the condition and its treatment. Which of the following statements by the mother indicates successful teaching? 1. I need be sure to take my child's temperature every day. 2. I hope I don't get a cold for my child. 3. Next time my child gets a cold, I need to listen to the chest. 4. I need to wash my hands more often. The correct answer is 4. Hand washing is the best way to prevent respiratory illnesses and the spread of disease. Bronchiolitis, a viral infection primarily affecting the bronchioles, causes swelling and mucus accumulation of the lumina and subsequent hyperinflation of the lung with air trapping. It is transmitted primarily by direct contact with respiratory secretions as a result of eye-to-hand or nose-to-hand contact, or from contaminated fomites. Therefore, hand washing minimizes the risk for transmission. Taking the child's temperature is not appropriate in most cases. As long as the child is getting better, taking the temperature will not be helpful. The mother's statement that she hopes she doesn't get a cold from her child does not indicate understanding of what to do after discharge. For most parents, listening to the child's chest would not be helpful because the parents would not know what they were listening for. Rather, watching for an increased respiratory rate, fever, or evidence of poor eating or drinking would be more helpful in alerting the parent to potential illness.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.